this third wave has been dramatically different than the first two. Patients tend to be much younger that are coming into the ICU. They tend to be much sicker, and they've caught us off guard. Oftentimes with the nature of their decline, or the rapid nature of their decline, and need for critical intervention. So it's been, a necessity, and it's been valuable that we've been able to be in a position to take care of these people, sort of in their, in one of the most vulnerable times in their lives. I think we're very fortunate to work in a collaborative team that's multidisciplinary, and we're always able to go to each other to, debrief scenarios or talk about difficult days and support each other sort of within the unit. And we're all one big family, and that's one of the most rewarding aspects of working together. And that collaboration really extends to patient care, because not one person in the ICU takes care of a sick person. It's a team of nurses and physicians, respiratory therapists, dietitians. There's a whole group of people that have to collaborate together to take care of these very sick and complicated patients. There's a certain calm in the ICU that's there now, because we've had that experience of this pandemic for the last year, and we haven't really we're not driven by fear. We're driven by determination and sort of a collaborative effort to just keep doing the best we can to look after these people.
Can you share a little bit about your feelings about taking care of patients from other areas in order to assist your physician counterparts in the harder hit areas?
Yeah, so again, I think this third wave is relatively unprecedented in that more patients are presenting in much more dire circumstances. They're getting sick and needing critical care interventions much faster than they were before. So they're really straining the provincial ICU capacity. And although we're always striving and expanding our sort of abilities to make sure that we take care of patients locally, we really have a moral obligation to act as really one provincial health unit at this point, because people a couple of hours down the road deserve the same access to care as people in Belleville or in Picton or Trenton. And if we've got the capacity and more importantly, the expertise, as does most ICUs in the province, we have an obligation to help to make sure that we minimize lives lost and complications from this.
So it's interesting when you look at the local numbers, right? Because we're seeing the local numbers go down. And I think that has, in some cases, created a bit of a disconnect between the hospital system and what people in our community may be experiencing, as we're all so ready for the pandemic to be over. Can you, I guess, give your message to the community around the vaccinations and the continued importance of the public health measures?
Yeah, and I think there's, although it's very encouraging that our local numbers are down and that perhaps puts some of our community members at less risk personally of getting the virus, that's not reflected in what's going on in the hospital, just because, as we mentioned, we're functioning as a provincial health unit and a provincial critical care service. And so despite us still having that local need to take care of people, we've had to expand it and take many patients from outside the region. And driving those numbers down is going to be important to sort of limit admissions locally to our hospital, because we need to be able to preserve that capacity to take care of anyone that comes in, regardless of their illness, COVID-19 or otherwise. And part of that is making sure that people get vaccinated, because it's going to allow those people in the community to protect themselves, to protect their family members, and ultimately decrease the amount of patients that we see come through the doors. We see, tragically in the news now, you're sort of seeing instances where patients aren't getting care, let's say for cancer surgery or other sort of urgent medical procedures that have been delayed, unfortunately, because of COVID-19, and that's certainly has fallen below the standard that we expect. And I think everyone in the community has their part to play in ensuring that they get vaccinated and follow public health precautions to really minimize the impact on our hospitals. I'm very proud with the way that our team has stepped up to the plate and sort of managed the pandemic moving or this far. We've seen a lot of COVID-19. We've been fortunate that we've gained some experience and been able to improve our practices in the hospital to take care of the people as best we can. And I think my hat goes off to everyone, across the organization who's really stepped up to take care of patients, not locally, but across the province. And we are going to get through this. The light at the end of the tunnel is near. And we just have to keep working together and maintain that collaborative spirit that we've always had.